Understanding hyperplasia, an overview of cell growth. Hyperplasia is the increase in the number of cells in an organ or tissue. It's different from hypertrophy, which is an increase in the size of existing cells. In hyperplasia, cells multiply faster than normal. This leads to tissue or organ enlargement. Hyperplasia can be physiological or pathological. Physiological hyperplasia is a normal response to a stimulus. Pathological hyperplasia is an abnormal response. It can be a precursor to cancer. Hyperplasia can occur in various tissues and organs throughout the body. Some common sites include the endometrium, prostate, and breast. The endometrium is the lining of the uterus. Endometrial hyperplasia occurs when the endometrium becomes too thick. This is often due to an excess of estrogen. The prostate is a gland in men that produces seminal fluid. Benign prostatic hyperplasia, or BPH, is a common condition in older men. It causes the prostate to enlarge, which can lead to urinary problems. The breast is another common site of hyperplasia. Breast hyperplasia can occur in women of all ages. It can cause breast lumps, pain, and nipple discharge. The causes of hyperplasia are diverse and can be broadly categorized into hormonal imbalances, genetic mutations, and chronic irritation or inflammation. Hormonal imbalances are a major contributor to hyperplasia. For instance, an excess of estrogen can lead to endometrial hyperplasia and some types of breast hyperplasia. Similarly, an imbalance in androgens can contribute to BPH. Genetic mutations can also play a role in hyperplasia. These mutations can disrupt the normal regulation of cell growth and division. This can result in the uncontrolled proliferation of cells. Examples include certain inherited syndromes that increase the risk of developing hyperplasia in various organs. Chronic irritation or inflammation can also stimulate cell proliferation. For example, acid reflux can lead to hyperplasia of the esophagus, and skin irritation can cause epidermal hyperplasia. Section 4. Recognizing the symptoms, a guide for healthcare professionals. Symptoms of hyperplasia vary widely depending on the affected tissue or organ. It's crucial for healthcare professionals to be aware of these variations to ensure accurate diagnosis. In endometrial hyperplasia, abnormal uterine bleeding is a common symptom. This may present as heavy menstrual bleeding, bleeding between periods, or bleeding after menopause. BPH often manifests as urinary symptoms. These include difficulty starting urination, weak urine flow, frequent urination, and urgency to urinate. These symptoms arise from the enlarged prostate pressing on the urethra. Breast hyperplasia can present as breast lumps, pain, tenderness, nipple discharge, or changes in breast size or shape. These symptoms can be similar to other breast conditions, highlighting the need for careful evaluation. Section 5. Treatment approaches. Navigating the options. Treatment for hyperplasia aims to address the underlying cause and manage symptoms. Options include watchful waiting, medication, and surgery. Watchful waiting or active surveillance involves monitoring the condition over time. This approach may be appropriate for slow-growing hyperplasia with minimal symptoms. Regular checkups and imaging tests are essential to monitor any changes. Medications can address hormonal imbalances or inhibit cell growth. For example, hormonal therapy can be used to treat endometrial hyperplasia and some types of breast hyperplasia. Medications that shrink the prostate are used in BPH management. Surgery may be necessary to remove excess tissue or the affected organ. This is often considered for cases that don't respond to medication or pose a risk of complications. The type of surgery varies depending on the location and extent of the hyperplasia. Early diagnosis and treatment are crucial to prevent complications. Hyperplasia, if left untreated, can progress to a more serious condition, including cancer in some cases. Regular checkups, screening tests, and prompt medical attention for any unusual symptoms are vital in mitigating risks.